Hello, welcome to Unleash the Power of Age. I'm Jennifer Lee Levitz, your host, and we have a very special guest with us today. As most of you know, the program is sponsored by the Gloucester Council on Aging, and most of our guests are from or speaking to the community of older adults. And today, our, as I said, very special guest is one Sonny Robinson. Hello, Sonny.
Hi, Jennifer. How are you?
I'm okay today.
Good.
How are you?
Good. I'm good today.
Good. You know, as we said, I wanted to say something about Sonny's name, Sonny Robinson. Nobody has that as a given name. So I think that the first thing I'd like us to get into is your name, Sonny. Tell me.
My name is certainly a blessing that I've lived with all my life, because it's been a motivation to try to always stay on the positive side, even though its origin is not completely positive, in that I was nicknamed Sonny by my grandmother because my mother was having to stay in the hospital for quite a number of weeks after I was first born. So as a baby in the hospital nursery, I was no longer a newborn. And so I was everybody's favorite because I was the sunshine of the nursery. So my grandmother told me, and therefore my grandmother nicknamed me Sonny, and it just stayed. But it actually is a responsibility I've been glad to carry, because it really is a nickname to encourage me and people around me to stay on the positive side. And my mother was a very positive and practical person, so I feel blessed to have inherited some of that personality from her.
Wow, that's great. So wait a minute. So Sonny, what is your other name?
Well, so my given name, or as we said in the 40s, my baptismal name is Margaret, named also for my mother, Margaret, but also she and I named for my great aunt Margaret, who lived independently until she was 97.
Whoa,
so a really absolutely totally terrific role model to get to try to follow.
I love it.
Yep.
How lucky you are to have role models who lived to those ages, and I would imagine, and independently.
That's right. Well, independently, but she also so she lived in San Diego, didn't, by the time she was in her 80s or 90s, have any other family out there, really independently, but she also had a great homemaker. And I suspect the homemaker did a lot more with and for Aunt Margaret than, in fact, the job description for straight homemaking actually provided. But it was the kind of wonderful relationship where Virginia would help Aunt Margaret out whenever she needed extra help.
Wow, that's really, that's just terrific. That's
Right.
A real gift to have relatives and people who lived before you live so long.
That's right.
Great.
Yep.
All right. So you are Margaret. So Margaret, where did you start your life?
So I grew up in southwestern Ohio, just outside of Cincinnati.
Wow.
And did all my early years straight through the College of Nursing and Health at the University of Cincinnati. And grew up roaming the woods and farmlands of southwestern Ohio. Lived and worked in the Cincinnati area right after graduation before going off to Peace Corps, Ethiopia.
Well, before we talk about Peace Corps, I would like to say that, my family are from Ohio.
I thought that was true.
Ohio. And I was born in Columbus. And there's lots around Cincinnati and Columbus and Youngstown. Even my dad
Right.
was Youngstown. So I'm a lot of Ohio.
Right.
Maybe that's that little
Right.
bit.
Right.
Sure.
Right.
Okay, there's a connection. Um, okay, so you went into the Peace Corps
Right.
in Ethiopia.
Right.
Please.
Well, again, it was I mean, I consider my 2 years in the Peace Corps really probably the most important 2 years of my education all the way along. I certainly was blessed to have nursing and healthcare skills and was teaching the core person in the Ethiopian healthcare team. I did not have the typical isolated Peace Corps volunteer alone situation. I was actually working for the Ministry of Health in Ethiopia, but assigned to what was then the sole public health college in Ethiopia.
Wow.
So I got to work in a really extraordinary situation with all of the best educated Ethiopians, as well as internationals from Europe, Australia, New Zealand, Canada, the United States. So it was totally an eye-opening experience in terms of how what we had then called the third world lived in such challenging situations. So it was just really, and I think I came to understand my own country a lot better by living outside of it and interacting with people from all over the world to see that the United States was not exactly seen exactly as we in the United States thought we were seen as the great saviors of the world.
You need to say this, Sonny, you're not in Cincinnati anymore. Wake up and smell the coffee.
That's right.
So that was 2 years. So
Right.
you left after Ethiopia, after Peace Corps. Were you still in the Peace Corps?
No. So after the 2 years, that's actually when I came to the Boston area.
Okay.
Because while in the Peace Corps, I got really interested in learning more about the educational process. So I came to Boston to go to grad school at BU in adult education and organizational development.
Wow.
So that's what brought me to New England. And then I have to say, I liked the Four Seasons of New England far better than I'd like some of the weather of southwestern Ohio, which you will understand. Spring and fall are gorgeous in southwestern Ohio. Winter and summer can be deadly. Sure. with lots of humidity. So to my mother's great disappointment, I decided to stay in the Boston area, which I did after grad school.
Okay. And then to Gloucester?
Well, to Gloucester, but not until 1995. So it was in 1995 where my partner and I were thinking, how do we position ourselves for our later years? How do we position ourselves for when we're retiring? And, by 1995, even on a nurse's salary, which were not so great at that point in time, it was becoming very difficult to afford to stay in Jamaica Plain, where I had been living.
Yep.
And so exploring options up this way, we all decided to come to Gloucester. And at that point in time, Jean was working part-time for Wellspring and then moved into a full-time position at Wellspring. And so we decided to come to Gloucester.
Okay.
So that was in 95. I've been here ever since.
And you've been here ever since?
Right.
I thought you'd been here longer than that. And then I realized that you probably got here during the time when I was away for a little while. That doesn't mean anything. So you retired from being a nurse, but were you a nurse, or what was your nursing career like?
So most of my nursing healthcare work was either in rehab, gerontology, or community health. I was never the kind of nurse who thought the ER or the intensive care unit were the most exciting places in the world. They were totally not what I wanted to do.
Okay.
I always chose nursing jobs or roles that gave me a lot of interaction with the patient and their family, and a great deal of rehab. You know, I worked many years at the rehab hospital in Cambridge. I'm not sure it's there. Uville.
Oh, Uville.
Uville Rehab. And then I worked in adult day health. I was a nurse in a adult day health program, and then the director of a couple of adult day health programs, the nurse manager on 2 different Medicare units in long-term care settings. So the whole community-based or long-term care, seniors and their families, really working with families to how families supported the person who was the patient in that setting.
Right.
And then that ultimately brought me to 2000, when the public health nurse position in the Gloucester Health Department opened up. And that was, if you remember, just after the community had done a big health needs survey, and they had identified a range of issues from senior health needs, senior housing needs, domestic abuse prevention, substance abuse prevention. So had identified a whole range of unmet community health needs. And the health director was Dan Ottenheimer, was very happy to hire me, coming not only with my healthcare background, but with my adult education background.
Sure.
In terms of how to put together campaigns, mobilizations, educational events, coalitions, etc. So it was a very exciting time to be at the health department, putting together all these different community configurations. And so it was a wonderful job to have as my last full-time job. And one of the things that I really helped do from the health department was work with the North Shore AIDS Health Project to get hepatitis C issues related to substance abuse issues included in the mission and mandate of the North Shore Health Project. So after I retired from the health department in full-time work, I then worked another 10 years part-time or as a volunteer with the health project, particularly focused on the Hep C work. And that was the time before we had all the wonderful, creative, tolerable treatment for Hep C that we had now. Right?
I know.
We had cure, but it was through interferon, and it was really pretty torturous.
Oh, I understand. My sister went through the interferon, and it didn't really work, and it made her very sick. She had to stop doing it.
That's right.
But then, when the new protocols came along,
That's right.
it was like that.
That's right.
It was
4
a
weeks.
piece of cake.
Right.
Changed her life.
That's right.
Changed her life. It was such a gift.
That's right.
Yeah.
Right. And similarly, it was really a gift for me to be there at that transition time, working with Susan Oleksky, building the program, and trying to support our clients as they went through the literal torture of interferon, and then transitioned into first 8-week cures and then 4-week cures. So
it was wonderful. It was one of the wins that we know was really a win.
Absolutely.
I'm going to look at my little notes here and a quick check. We're actually almost halfway over already. So we know about before Gloucester. We know about your early time here. We actually have you up to your retirement, but nothing. You haven't stopped at all. I can't imagine. I mean, you work full time at all the things that you do.
Well, I don't work full time anymore at all the things I do, but I have stayed involved in quite a number of things, and particularly housing, and trying to be a part of all the networks in the community, creating the housing options that we need. One of my favorite responsibilities when I came to the health department, was chairing the Senior Housing Options Committee. And what the health department recognized was that housing and health go hand in hand. If you don't have secure, reliable housing, you have great potential for health challenges. So really working with the community to try to advance additional housing options as a way of promoting health was a big thing that I started when I was at the health department, and then have continued with housing in my so-called retiring years, being my chief focus, because I think in terms of community health, the absence of adequate housing is one of our biggest challenges. And since literally the very weekend that I arrived in town in 1995, I've been out there trying to advocate for more housing options across the range, from
Sure.
very low income to just average and middle income, because there's not enough of any of it for any of us, regardless of generations.
Oh, I think we all have personal experiences with this.
Right.
You know that I'm on the Housing Authority Board.
I do.
So I have that, and I'm on the Community Preservation Committee
That I didn't know, but that's great.
as the Housing Authority member.
Right. Oh,
So
good.
I'm like in the thick of it now.
Right.
In ways that, I used to, my main focus was always been theater and performing arts and being an artist, a visual artist, a video artist. All of those have been my occupations and my hobbies and my whole life. And one day Safathia said to me, "Hey, would you like a part-time job?"
Right.
And I went, "Sure." And I ended up on the Housing Authority Board.
Good.
Boy, talk about an education. And it has affected all parts of my life. And it was a real gift. I love the people I work with on that committee. They're stellar. That is, the Housing Authority is run by by lovely, caring, hardworking, organized to the nth degree people who really, really go the extra mile.
Right.
And I've learned a lot. Also interacting with clients. Right. We're not allowed too much, but
Right.
it happens. So,
but Jennifer, I have to tell you a funny story that you don't know, but I do.
oh, tell me.
So whenever it was that you were actually appointed to the Housing Authority Board, I had just written Safathia a letter saying, "Gee, I'd be interested in being on the Housing Authority Board." And poor Safathia had to say to me, "But Sonny, I can't do that. I've just promised it to Jennifer."
Oh my goodness.
So that, right. So now we intersect doing the advocacy in the community, which is terrific.
We do. I frankly think that it's just as well that there's a stipend, and it's nice to have. It's a little one, but it's nice to have. But this, I see you as being much broader than the Housing Authority. We have to, I have to sort of stay in line a little bit.
That's right, you do.
I'm an advocate for
That's
a
right.
particular organization. And I like it much better having you free ranging and
Right.
being on your own.
And I would certainly agree with you at this point in time that, in fact, that having not worked out has actually given me the real freedom and breadth to, for example, work with Cape Ann Local Action on the things that we did to try to and succeeded in helping make some very positive zoning changes back in 2019 and 2020, and now working very much with Housing for All Gloucester, trying to expand both the deed-restricted affordable housing, but also try to figure out how we incentivize creating housing that is affordable to the average income person in Gloucester, because nobody, including me, I mean, if I had to move out of my house, there's no place as a senior that I can move to without potentially facing a 3 to 5 year or waiting longer period. And because I and my partner don't move out of our very modest, single family home, our home is not available to the next middle generation who might be interested in moving out of an apartment into a first family home. Not to mention what the cost of a mortgage would be at this point in time.
Exactly.
So, I think my housing history and my housing advocacy directly comes out of not just my commitment to the community and to other people in the community, but is influenced more and more every week by the fact that I'm now very substantially a senior myself, facing exactly the same housing challenges that most of us, the greatest majority of seniors face, but also middle-aged and younger people face in terms of the housing crisis.
I think so. I think you're absolutely right. I would like to acknowledge at this point that Sunny is receiving an award. We're not sure all of the details, but it's from Senior Care. Let's say that it's basically an award for being a senior who is still so active in the community. You are a force, and people know you and they respect you, and you're being acknowledged by your peers and by the community, and I would like to applaud that. And I think it. I bet you've had other acknowledgments.
Well, when the Health Project started the annual Hepatitis C Advocacy Award, I got the first award there.
Okay.
That was wonderful.
Okay.
But the housing thing, I mean, the acknowledgement from Senior Care is really wonderful, because I think there are a whole lot more people who, like me, have stayed deeply involved in the community, and that deep involvement is really not recognized. But I'm both honored and delighted and surprised to receive this award, but I feel like, given the chance, I could reel off the names of 24 other older people, mostly women, but not all women, who have stayed deeply, deeply involved. So there are lots of us who deserve this kind of award, I think.
Well, I can't argue with that. I think that well, first of all, there's the percentage of older adults in Gloucester is relatively high.
Right.
And I also think that there's being part of the Council on Aging. I would like to toot our horn and say that the Council on Aging is extremely active, involved in important ways. And I mean, even if you only look at what goes on at the Rose Baker Senior Center, there are many people in town who would be lost without the Rose Baker Center. All of us get our trash bags there. We get when it comes time for open enrollment for Medicare every year, the Shine counseling that goes through Rose Baker is phenomenal.
Right.
We get our taxes done there.
Right.
We can go there for lunch every day, but certainly at least 2 days, if not 5 days.
Right.
And there are exercise activities and intellectual activities and just silly stuff, and a place, when you talk to people about why they're there. I used to do constant interviewing of the clients at Rose Baker, and one of the key elements of why they go there, why we go there, is for companionship.
Right.
To get out of the house,
Right.
to have a place to go,
Right.
and to meet with peers is a lifeline. It's the lifeblood of staying sane for some of us.
That's right.
But just being,
Absolutely.
that activity, that being active is so important. So I think that, well, I know that being an older adult in Gloucester is a pretty good place to be.
Right. Absolutely. Yeah, and I think we've been blessed with having an excellent senior center ever since I came to town, but it only grows and gets better and better. And I think what the current Council on Aging and led by Elise Sinagra are doing, and just ever expanding the kind of activities that are available there, is so terrific. So terrific.
Well, I'm glad to hear you say that.
Absolutely.
I am. I'm going to look quickly at my note, senior care housing for all. I don't want to get heavy or anything, but if you wanted to say, in closing, what would you like to say to people?
Well, I think especially in light of this conversation and the award upcoming in a couple of days from Senior Care, what I would say is stay involved. Find your place in the community. Stay involved. We live in very challenging times, and across all of our generations, we need to bring together teams of people who are the young learning from the older, and those of us who are older learning from young, and teaming up and doing it intergenerationally, so that we continue to build a community that works for everybody. And I think that's the kind of thing that's most important to me. I feel really blessed with the half a dozen younger people who I've gotten to know and work with in the last 3 to 5 years. And I think they feel the same about working with older people like me.
I'm sure that,
Right.
that's what it is. And I would like to say, brava, Sonny Robinson.
Well,
thank you
thank
so
you.
much for being here today.
Well, thank you for having me. It's been a great conversation.
It has.
Right?
Okay.
All right. Thanks so
That's
much.
it, folks.